All right, we've got another question posted in the comments section, this time about the difference between DMDD style tantrums and manic symptoms in kids. Let's dive in. Hi out there, this is Dr. Brett Pearce, child psychologist, coming at you with a video about disruptive mood dysregulation disorder, specifically responding to a comment posted on the channel about how to understand the difference between disruptive mood dysregulation disorder style rages and irritability versus manic episodes. So just to provide a little background, disruptive mood dysregulation disorder, or DMDD for short, is a childhood depressive disorder characterized by intense rages. It was either created or discovered, depending on how you want to think about it, back in about 2013, or maybe a few years before then, when the DSM-5, which is the manual that we use to make mental health diagnoses, was published. And the reason for this is because there was a lot of kids who were being diagnosed as bipolar on the basis of the fact that they clearly had mood concerns, like they were unhappy, they were sullen, they were sad, maybe they were suicidal, they were also very angry and explosive. And so it became sort of a thing to call these kids bipolar, which became very controversial because these kids did not have what are viewed as true manic symptoms. So what is a manic symptom? Well, the thing to understand about bipolar disorder, at least as it's defined, is that you must have manic episodes. And I do mean must. You must have manic episodes. That is what bipolar disorder is, effectively. In fact, you can be diagnosed with bipolar disorder on the basis of manic episodes alone, even if you don't have much in the way of depression. So it needs to be episodic, which means it kind of comes and goes. It doesn't seem to necessarily be clearly triggered, although it certainly can be exacerbated by stresses and things like that. But effectively, it's almost like it's on a calendar or a clock in a sense. And these episodes need to last a while. Certainly not just an hour or two or three, or a day because the kid's having a bad day, but often days or even weeks. And these episodes are characterized by elevated and expansive mood, perhaps irritability, erratic behavior, racing thoughts, decreased need for sleep, increase in goal-directed behavior, such as someone who maybe goes manic and starts to clean and reorganize their house over and over again in the middle of the night, and then hasn't slept in a few days but still has a lot of energy. And it's not my intention to, mock anyone who experiences mania, but I'm just trying to illustrate the point. Generally speaking, manic episodes feel good. Not always, not all the time, but generally speaking, they feel good. And if you've ever worked with or talked with or been with someone who truly has bipolar disorder, you can often, particularly if they get medicated, often, not always, there's a sense of loss at losing the manic episodes, because very often the medication will really help with those in particular, from what I've seen in my experience as a psychologist. So in terms of how we differentiate intense explosive rages from manic episodes, well, I mean, in some sense, there's a big difference. I mean, explosive rages don't feel good. They're not elevated and expansive. They're angry and explosive. Very often in the field of psychology, we talk about things that are ego syntonic versus ego dystonic. And I don't mean to introduce really hyper-intellectual sounding older school psychobabble language, but I think these are useful concepts here. In general, manic episodes are thought to be ego syntonic, which is to say they feel good to the person. I'm not saying they truly are good. Comparably, something like narcissism often is relatively ego syntonic. Like it in a sense, it feels good to the person. Whereas like explosive rages, not necessarily ego syntonic. Certainly in general, DMDD is not ego syntonic. I mean, kids who have DMDD are not happy campers. They're definitely very mood troubled. So that's one way to look at it. Another way to look at it is, well, if your kid has some explosiveness and irritability, and also all these clear manic episodes, and they go through the irritability during a manic episode, then you're probably going to want to think, okay, well, it seems like the irritability and maybe some of the temper issues, if there are any, appear to be a function of mania. Whereas if your kid does not have all these other manic symptoms, then you'd be thinking in terms of DMDD, if that's what your kid really has. So recognizing the difference sometimes maybe in the moment might be challenging, but the one part of the confusion here, I think, and it's understandable because it's out there even in the field, is that people think of just mood dysregulation, like specifically explosiveness, not even just in general, just explosive tempers and big emotional dysregulation. That is to say, like maybe tantrums or things like that. People think of those as being sort of automatically manic, and they're just not. Like, it's a common confusion. And it's part of the reason, in my view, that you see a lot of adults who truly have borderline personality disorder who are diagnosed with bipolar disorder, often quite inaccurately. And that's because what they have is borderline personality disorder style fragility, which I don't mean as a criticism per se, but explosiveness, emotional dysregulation, and easy reactivity to like interpersonal stressors and impasses, etc. And that's just not a manic episode. It's just not. Manic episodes look a lot different usually, although it's true that sometimes someone on a manic episode can end up with emotional dysregulation just because they're just so with their energy and everything like that. So I hope this answers the question. It's a good question. But basically, you need to understand that manic episodes look different from rages by and large. And then sometimes the best you have is to understand more about the kiddo's history and everything else to try to make a decision as to what's going on. But in the moment, usually what you need to be doing is focusing on what you need to do to help the kid cope and to help de-escalate the kid rather than worry too much about the origins of a bout of rage. But once it's done and you're trying to figure out what's going on with the kiddo, yes, of course, you want to think this stuff through very carefully. So at any rate, I hope this was helpful. Thanks again for listening. This is Dr. Brett Pearce, child psychologist, about to sign out. Thank you. Bye-bye.